Hi everyone, very good afternoon guys. I hope I'm audible and visible to all of you. Can I get a quick confirmation or a thumbs up or a yes? Okay, I have so. So yes, we've got a session today which is going to be actually two things. First, we've met in this afternoon, so we might as well solve 4 to 5 questions quickly. And other than that, I'll also be informing you about a new batch which is starting for Path and Micro. So I want to give you an update about that, which will be starting in the month of October. So yes, I'll be briefing you about the same, the dates and the topics and everything. So yes, that's the later part of the story. But since we've met first, I think it's just that we practice a few questions. So everyone's ready, I hope. And let's start with something very, very simple. It's a lengthy question, but I think most of you are going to get it right. That question number 1 for all of you. You move the video bubble around if blocking of the question. And here I'll start with the poll, 30 seconds. Who are joining in, okay, so the poll is up and most of you have given a correct answer, and that is going to be option D. So audio issue, as Dr. Sabreen has mentioned. Anyone else facing an audio issue? Is all well otherwise? A quick thumbs up if everything's well. Okay, all's well. Dr. Sabreen, you'll have to probably check in with your network at one end and at your end. So I think that should be fine. Okay, there's an echo. Right, just give me a moment, please. Okay, so let me know if now everything's working fine. I've changed the network. I hope things are better. No AV lag. Okay, perfect. Right. So most of you did give me a right answer. 33% answered it as Malassezia furfur. So yes, or if you wanted to call it Tinea versicolor, same thing. So let's read about it and then we'll come back to this question. Okay, so when I talk about Tinea versicolor or P versicolor, as all of you are talking about it, so that is a superficial mycosis, which means which is going to affect the skin. And how does it affect the skin? So instead of calling it Tinea versicolor, it's better we learn it from the name of the organism, and the organism causing it is a fungal organism, that is Malassezia furfur. So there are 2-3 very characteristic points that we look out in the exam to identify this fungus. First and foremost, this very, very classical feature where, yes, you can either see hypopigmented lesions or you can see more common one, obviously the one that has been shown to you. The more common one is going to be hypo. Hyper is also a possibility, but all of you can see these hypopigmented lesions. They are on the trunk. Again, the hypopigmented lesions being present on the trunk is a more common thing that you find. That is one thing. So did I have that history given in the question? Yes, on physical examination, there were multiple hypopigmented lesions that were there. Further, they said that there is no allergy, there is no medication known, there is no chemical exposure. After that, they've also said that the culture was isolated, but microbiologists could not get any results on a regular SDA media. So, which of the following fungus is difficult to isolate on a regular SDA media? That is Malassezia. So, if you say that, ma'am, if I take a little bit of the skin sample from here and if I try to grow it on a regular SDA media, you won't be able to grow it. What are you going to do? First and foremost, you'll take a little bit of skin scraping. Let's talk about general, not just this fungus. Whenever we take a general scraping, what do? Like skin or hair or nails? Why am I clubbing them? Skin, hair, and nails. What do they have in common, guys? Answer of olive oil is fine, but let's go back to basics. Skin, hair, nail, they have something in common known as keratin. Yes. So whether you take a skin sample or a hair sample or a nail sample, they'll have a lot of keratin. If you have a lot of keratin, keratin is very hard. You can't look at it under the microscope. So you'll say, ma'am, first you will apply a KOH mount. Why do we apply a KOH mount? Because KOH mount, K for K. What does KOH digest? digests the K for keratin. So please remember, whenever you have a keratinous sample like skin, hair, nail, digest it with KOH. And now what do you see under the microscope? Firstly, it's KOH, it's a chemical. Will you see any colors like pink, blue, green? We usually see. Here we won't see any colors because it's a chemical, right? You will say that, okay, I'm seeing a bunch of these small, tiny dot, dot, dot kind of organisms. So this is what I'm seeing. And along with that, I'm seeing a few extended forms also. I'm seeing a few extended forms also. So that is what is known as, so this part of it is said to be the meatball, and these extended hyphal forms, they are said to be the spaghetti. So spaghetti and meatball appearance is what you see with Malassezia furfur. For those who are vegetarian and don't like spaghetti and meatball appearance, you can call it the banana and grapes appearance. So the lengthy ones are referred to the banana, and these dot 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 forms are referred to the grapes. So spaghetti, meatball, banana and grapes, everything is the same for us, right? Now you'll say, let's grow it under a culture media. KOH mount is done. Now let's grow it under a culture media. And we realized that a regular SDA was not enough. Why? Because Malassezia furfur is a lipophilic. Malassezia furfur is a lipophilic organism, which means it's oil loving, lipid loving. So you'll have to give it some oil. And what do you give it? You give it olive oil. Okay, and so this is what culture media. This is not a regular SDA. This has been a layer of olive oil on top of it. And then if you zoom in and you see what kind of colonies we've got the very classical fried egg appearance, right? We've got the very classical fried egg appearance, which is another fried egg appearance that has been added onto our list. I'll obviously ask you for that entire list in a while. But meanwhile, I've understood Malassezia furfur grows on SDA with olive oil, and in the oil, you'll fry the eggs. That is how we learn it. In the oil, you'll be frying the eggs. So fried egg appearance is what you get. Now, what is this picture shown over here? What stain is it, if I ask you? What stain is it? You'll say, ma'am, something blue color. Whenever in a fungus we see a blue color stain, that's the rule. It's LPCB. Yes, lactophenol cotton blue. Lactophenol cotton blue. And here, can you again see the same spaghetti and meatball kind of appearance, or the banana and grapes kind of appearance? Yes. So yes, that's all about this, and exactly what the question was. You could not grow it on a regular media, that is Malassezia furfur, because you will have to grow it on that olive oil overlay. Now that you've done this question, now tell me all the fried eggs that can probably come out to you. Every fried egg in path and micro. Since you're discussing micro, tell me all the fried eggs in micro. Number one, we've done Malassezia furfur. Any other colonies which are also fried egg? Amazing. The more famous one, the very famous one, that is Mycoplasma colonies. Mycoplasma colonies fried egg, Malassezia furfur is going to be fried egg. Coming to the next, coming to pathology. Tell me some ovarian tumor. I'll ask you organ wise. Okay, tell me some ovarian or testicular tumor. So if I'm saying ovarian and testicular, means there are only one counterpart. In the testis, it is seminoma. In the ovary, it is dysgerminoma. Okay, if I ask you, tell me a tumor in the brain which has this kind of fried egg appearance, you'll say, ma'am, the tumor in the brain has oligodendroglioma, which basically means that all the O's are coming, all the eggs are coming in this oligodendroglioma. Yes, O for eggs. And that is going to be the fried egg appearance. Okay, anywhere else in hematology that you see? Bone marrow biopsy of which condition? Perfect, hairy cell leukemia. Again, that's a question. All the INI-CET aspirants, keep in mind, hairy cell leukemia bone marrow biopsy shows you fried egg appearance, not a bone marrow aspirate. That's one of the major catch points that they give you in the exam. So, well, having said that, yes, those are the major fried eggs that you have. Those are important. You've done one of them over here, the spaghetti and meatball Malassezia furfur. Okay, now that we've done one lengthy question, we'll do one very quick short question. And quick answer, I'll give you 20 seconds. Which of the following is used for the culture of Rhinosporidium? Okay, last 10 seconds. Okay, 23% of us got it right. So what all has been written over here? First and foremost, when I'm talking about rhinosporidium, and I see you'll say, firstly, is it a fungus or is it a bacteria or a parasite? So let's study about rhinosporidium. Yes. Remember, rhinosporidium was earlier said to be, I think the font is a little smaller over here. We'll just write it again. If I ask you what is the organism that is there with rhinosporidium, it is rhinosporidium seaberry. It is Rhinosporidium seaberry, and that is how we've learnt it, that earlier it was said to be a fungus, but the sea now reminds me that it is a sea, it's in the water. It's actually said to be an aquatic parasite. It's said to be an aquatic parasite now onwards. So yes, earlier it was put under the fungus category. Now remember, Rhinosporidium seaberry is aquatic. Okay. Having said that, what is the most common site? If I have to ask you, someone is suffering from rhinosporidiosis, what is the kind of clinical presentation? Yes, what is the gross and the site, clinical manifestation and microscopy? Let's see that with the help of some pictures. So this is a very common site, the nasal cavity, the nose, or if not the nose, then what else? Even the genital organs can be affected, vulva, vagina. So those are the kind of sites where you get affected, but most commonly it's going to be the nose, and you can see this nasal polyp, which is looking like a fruit. Is it looking like the strawberry? Yes. So this is a strawberry appearance that you see, or the strawberry polyp that you see in a case of rhinosporidiosis, one of the classical pictures that you got. And when you look at this under the microscope, in that, okay, you want to call it a mulberry, call it your imagination, some berry basically which looks like this will work in our case, right? Okay, having said that, now what do you see that under the microscope? Under the microscope, you have these round structures, round structures, and these round structures have something hidden or something embedded inside it. These round structures have something embedded inside it. Yes, so these big structures are said to be the sporangia. These big structures are said to be the sporangia, and then the other ones, the round dot thing, those are the endospores. Perfect. Those are said to be the endospores. Well, having said that, that's again a classical picture that you're going to get over here. Having said that, Abhi, we are not done. What was the question? How will you do the culture? How do we do the culture? Because it was once upon a time said to be a fungus, do we grow it on SDA? No, remember, it cannot be cultivated. This is a non-cultivable organism, means neither any agar like SDA. And what are these two? Hella and Hep2. What is that? Hella and Hep2 are what? These are said to be cell lines. What do you grow in a cell line? A bacteria, usually bacteria or virus or parasite. Usually it's the virus that is grown in cell lines. So this is obviously not a virus also, so it can't be grown on these cell lines. Basically, it's non-cultivable. That is the most important point that you have to know. It is going to be non-cultivable. Okay, having said that, so a simple second question is also done. Let's move on to the next question, which requires a little bit of reading carefully. It's easy, but just twisting the words around. 30 seconds, begin. It's a PYQ. Okay, 56% of us are good with PYQs. It is a viral mediated bacterial recombination. So what do we have? What do we mean? Actually, if you know the diagram, right, then this definition becomes very simple. So what is a transduction? Let's take an example of, for example, this is one bacteria, this is one bacteria, and this is another bacteria. Okay, these are the two bacteria. So I label this as the donor bacteria, and I label this as the recipient bacteria. And what do we have to do? This bacteria wants to donate some material to this one. So some genetic material like this, for example, you want that this genetic material from here should go on to here. But how will it go? That's the point. How do I transfer it? So I take help of something known as, and what is this thing that I have, this hexagonal tadpole like thing that I have drawn over here? What is that? Yes, that is a bacteriophage. Now, bacteriophage is like a is like one of those food delivery app, right? Which is picking up food from one place and giving it to another place. That is what a bacteriophage does, right? So it's going to go, it's going to pick up this material from here, it's going to pick it up from here, and it's going to go and give that material to this particular bacteria over here. So this material will be delivered. So just picking up from one place, giving it to another place. Now my question is this a bacterial transfer or a bacterial recombination that's going to occur? Yes, one bacterial material going to another bacterial material. So it's a bacterial recombination. And who is doing it? It's going to be bacteriophage mediated. What is a bacteriophage? Bacteriophage is nothing but a DNA virus. So if we find out what does a bacteriophage belong to, what family, it's DNA virus. So can I say this process is viral mediated? So finally, what's the definition of a transduction? It is a bacterial recombination, but who's going to do it? It's going to be done by a DNA virus, and that is viral mediated. So as I said, if you know the diagram well, then the definition is just playing around with words and it's nothing very difficult. All good? Let's move on to another very, very simple question, which is the revision of a mnemonic. So let's see how many of you remember that mnemonic very well. Quick answer, 20 seconds. Which of the following is not dimorphic? PYQ and a very important topic. So anyone who remembers the mnemonic can also definitely share that with us. Yes, that came in the NEET exam. Body heat probably changes shape. Before that, you'll have to tell me the meaning of the word dimorphic. Yes, the poll is done. 47% of you have given a right answer. What is the meaning of the word? You'll say, ma'am, di means two, morphic means morphology, which means it's going to exist in how many forms? Two forms. Yeast form and mold form. Guys, what do you understand by mold? Yeast, we know, dot wala form is yeast form. What is mold? Mold is nothing but the hyphae. Mold is hyphae. So yeast form is seen at 37 degrees centigrade and mold form is seen at a 22 to 25 degrees centigrade. And how do we learn it? Yeast is at a higher temperature, mold is at a lower temperature. So we learn it as yeast is going to rhyme with heat. Yeast is going to rhyme with heat and mold is going to rhyme with cold. That is how you learn the mnemonic. So yeast and heat, mold and cold. So yeast at 37, mold at 25. Now all of you gave me a mnemonic that is body, heat, probably changes shape. That is correct. The heat is changing the shape, right? So that is what I've made as my mnemonic. Body heat probably changes shape. So B for what? I don't see a B in the options, but blastomycosis. Please repeat. Very important question. Blastomycosis. H is something I can see in the options also. Histoplasmosis. Okay. Next, P is going to have two things. One of them is Penicillium marnifi. Now, I hope all of you remember that Penicillium marnifi is also given another name which is written over here. Talaromyces marnifi. P. marnifi is also known as Talaromyces marnifi. Another P that you have is Paracoccidioidomycosis. Paracoccidioidomycosis. You cut out the para, you get the C. Only coccidioidomycosis. Coccidioidomycosis, and the last one S is for sporothrix, which was again there in the option. So I realized histoplasma is there, sporothrix is there, Talaromyces marnifi is also there. Basically, Cryptococcus neoformans is not dimorphic. What is Cryptococcus? Cryptococcus is what, guys? Is it a yeast? Is it a hyphae? Is it a dimorphic? It's a true yeast. Only and only yeast form is seen with Cryptococcus neoformans. Now, all the students who are going in for the INI-CET exam, very good. Dr. HM says, ma'am, Cryptococcus is the one that has that capsule. So, all of you are going to tell me that what is the most common clinical manifestation that Cryptococcus, how will a clinical question on Cryptococcus come as? They will always come as a question to you with meningitis. Cryptococcal meningitis in an HIV positive person, that's like the most characteristic history that they have. HIV positive or seropositive person with a meningitis history. So now they'll say that two things could be done. Someone coming up with meningitis means you're going to do a CSF examination. So if you want to check out Cryptococcus, what is that stain that you're going to use, which was there in the last INI-CET also? It is the negative staining, yes. And the best example of a negative stain that we have is India ink. Perfect. So if you get a CSF sample, you will do India Inc. Where's the twist in the story that's going to come? If you get a CSF sample, you do an India Inc. But if you get a biopsy, if you get a tissue sample for Cryptococcus, then we are going to do the next stain, which is mucicarmin. Yes. So these are the two stains and exactly how the question comes. It has been previously a question. Cryptococcal meningitis and CSF sample given, the stain becomes negative stain or India Inc. Cryptococcal neoformans, meningitis, tissue sample given, and the stain becomes mucicarmin. So just one word will change the option for you guys. Is that okay with everyone? This question also going to be done. I have a question that, ma'am, are both forms infective? That depends on organism to organism. You cannot delineate that, only one or only both are infective. That obviously is going to be dealing with separate ones for sure. Okay, so still, if you say that, ma'am, can you tell me that, okay, I have the next question, which I was going to ask, that for Cryptococcus, what is that rapid test, which is actually said to be the most LAT, guys? What is LAT? Latex agglutination test. Do you remember that? So that is something which is a rapid and it's coming as a card test also. Latex agglutination test. That's actually the third question that you get. So Dr. Arjun, I hope you've been able to identify it. Dr. Alia is asking me, ma'am, doesn't this show the Mickey Mouse appearance? No. Where do you see the Mickey Mouse appearance? See, firstly, I'll draw it out. You are wanting to say Mickey Mouse appearance. If instead of Mickey Mouse, the two ears of Mickey Mouse, if I make many ears, will this also look like the pilot wheel appearance? Yes. So even if you call it Mickey Mouse appearance or you call it pilot wheel appearance, then P for P. Remember, pilot wheel appearance. That's your question that you had. Pilot wheel appearance will be seen in paracoccidioidomycosis. So remember that pilot wheel or that Mickey Mouse, that is going to be seen in paracoccidioidomycosis. Okay, so there should not be any confusion out there. Okay, so having said that, now I'm coming to one question for the FMG students also, in case any of them have joined in, and even INICT and others will tell me. I'm not putting up a poll over here because this is a multiple option question. If you feel multiple options are there, give me. Otherwise, give me one option, your wish. What do you feel CA19-9 is a tumor marker of? CA19-9, select the best answer, select the options that you feel are right. Most of you say, ma'am, just one. Okay, so guys, if this would have come as a single question, even I would have answered it as pancreatic cancer, because my mnemonic has always told me that CA19-9, if I invert the 9, flip the 9, I get a P. So that is going to be pancreatic cancer, right? So even if I had to select like one option in the exam, I would have also gone for pancreatic cancer. But if you look at the options given in Robbins and the other textbooks, colon cancer is also a condition where CA19-9 can be used. So if you have like multiple options, then you go for both. But in the FMG and in all the previous year papers, it has come as single wala question, single option. So the single best option is pancreatic. Lung, we have other better markers now, so we don't really rely for CA19-9, so you can skip that. Okay, we have CEA, we have other very good markers, so CA19-9 is not being used. As I said, pancreatic and colon, that's about it. Okay.